It's been a really difficult decision to close the beds at Holsworthy. There are two main factors that have led to us making this decision. The first one is that we have had difficulty with staffing the inpatient unit, and that has caused us to use a lot of agency staff. Some of that is related to vacancies in both the nursing staff and the allied health professionals, so they are physiotherapists and occupational therapists. Others are around some staff sickness that we have had for very legitimate reasons. We have just the same had to fill those shifts. The second thing is that for some time now we have seen a sustained pattern of low numbers of people coming into the beds at Holsworthy, which has meant that on any average month we are only having 10 patients in the beds when there are 16 beds there. That means for our staff they are at high risk of getting de-skilled because they are not seeing the numbers of patients that we need them to see.
The problem with low bed occupancy and clinical skills is that, as you are aware, the length of stay for our community hospitals is around 23 days for a patient. If you only have 10 patients in at any one time, over a period each on average for 23 days, then the range of nursing skills that are required to manage that patient are therefore restricted. You don't have the opportunities of clerking in and doing all those other things that you need a constant turnover of patients to help maintain your skills.
When you're looking at risks like this, it is always a careful judgment, and we've actually been worrying and looking at this for many months, even possibly more than a year. And there comes a point when actually we don't think we can hold this risk anymore. We think the likelihood of harm occurring is increasing. And we came to that point a few weeks ago when there was just no sign of the level of agency reducing or of the occupancy increasing.
No, we have looked very long and hard at how we can recruit in different ways to fill the vacancies, but safety is our primary concern. We need to make sure that our staff are supported and can continue to deliver the continuity of care that people expect. We have already undertaken a review of the way we use our community hospital beds in Holsworthy to see whether we could use them in a different way and encourage more people into the beds. Unfortunately, we were unable to identify more people who could go, and the rehabilitation of those people is difficult when we have vacancies in our therapy staff. We have also, at times when we are able to, encourage staff from the North Devon District Hospital to come and fill the shifts at Holsworthy Hospital, but this is very difficult when we have our own winter pressures in the acute trust too.
Well, we're still seeking to recruit. We're meeting with the CCG, the Commissioners of Healthcare, to see what we can do with them to see what other options there are. But there are no quick solutions, and it will take some time to work through those options with the CCG.
No staff will be made redundant as a result of this temporary closure. It is a temporary closure, therefore the staff will continue to be employed. They will, however, be supported by staff side to explore other opportunities within the trust for continuing employment.
I can't say how long the beds will be closed for. We will be working with the clinical commissioning group to look at whether there are opportunities to reopen the beds, but also how we support the patients from Holsworthy in their own homes in the most effective way.
We would, if we were able to recruit nurses and therapists and get the establishment up to what it should be, then we would then be looking to see how we can increase the number of patients going through those beds.
We have made a huge amount of changes to enable us to reduce the level of agency staff that we use. What we have found across the whole of the trust is that when we reduce the agency usage, our safety on the wards improves. That means that people are less likely to fall on the wards and less likely to have things like pressure damage. The reason for that is that the agency staff are not used to the set out of the wards, and they are often only there for the odd shift before going elsewhere. It is very difficult. They are qualified staff. It's really difficult for them to get a grasp of their environment in a quick time. All of our staff work incredibly hard to provide safe services. What we have identified is that if we continue as we are with the level of agency usage and the low numbers of patients in the beds, the patients will be at risk of greater harm, and therefore we are taking this decision before any harm happens.
As I'm sure many of you are aware, we do have already well-established community teams working in the Holsworthy area. They're providing a great service and are able to support patients so that they are not needing to be admitted, and can also support them such that they can be discharged from hospital that much earlier than used to be the case. So the staff that are currently working in the hospital will have the opportunity of training to actually go and support those community teams so that they can be further enhanced to actually ensure that there is the capacity to manage the extra number of patients that we would be talking about.
Well, the first thing I'd say is that is recognised as a national problem. However, it is at North Devon, it is a much smaller problem than elsewhere in the country. We are recognised nationally as having very few what are called delayed transfers of care. And currently our Devon Care Service, the domiciliary care service we coordinate, they have no service users waiting for packages of care. So it's actually far less of an issue for us than elsewhere. The Department of Health recently issued some targets for acute hospitals to reduce the number of beds occupied by patients that don't need to be there. Ours was 6. That's 6 for the whole of North Devon. So for the community of Holsworthy in particular, it would have made virtually no impact.
I fully understand the distress that this is causing the community, because there is a lot of support for our community hospital services and particularly the inpatient beds. But the Trust has to look at maintaining high quality and safe services going forward, and look at all the challenges that we face, and that led us to making this difficult decision.